Today we are discussing about the oropharyngeal airway, nasopharyngeal airway. In the nasopharyngeal airway and the oropharyngeal airway, which are the equipments which we should use. Separate sizes we have to take 8, 7 number and 6 number. These are the used to in the adult patients. And the OPA, the size will be started from the 1, 2, 3 up to 4. The 1 will be used for pediatric, 2, 3, 4 will be used for adult. Okay. These uses we need to arrange the appropriate according to the sizes of the OPA and NPA, and the lubricant jelly, and the surgical glove, and the PPE kit, and the suction operator. Okay, these are the things we need to use when we are using procedure. Okay.
Good afternoon everyone. Today we are discussing about NPA and OPA. NPA means nasopharyngeal airway and OPA means oropharyngeal airway. So now I am discussing about the NPA. So what is NPA means? It is a flexible tube which is inserted through the nose to clear the airway obstructions. So for which patients we are using this? This is only using for conscious or semi-conscious patients. We are not using this NPA for unconscious patients. So what is the indication? Which patients we are using this NPA means for upper airway obstructions. Any patients is there means we are using. Any altered sensorium patient is there means we are using. Any seizure patients we are using, or any any sedations. If we are giving any sedations means we are using this NPA. So for these patients we are using, and what all patients we are not using NPA means any facial deviations is there, any facial trauma is there means we are not using, any nasal septal deviations is there means we are not using, any trauma is there means not using, and any nasal polyps is there means we are not using, and evidence of CSF leak is there means we are not using this NPA. So what is the technique? When we are taking any NPA means we have to measure the size. Which size is apt for our patients? First we need to measure that size. So how we will measure that size means from the nose to the earlobe. So when we are taking any NPA, this is the bowel part and this is the tip. So when we are measuring this tip of the nose to the earlobes, we have to measure. So from here to here we have to measure and take the correct size of the NPA before using the patient. So before using this also we have to lubricate. Any lubrications we have to use. Why? Because we have to prevent any frictions or any bleeding, any trauma. So for preventing that only we are using that lubrications. So how we are inserting this one means, first we have to apply any lubrications. After applying lubrications, this is gently inserted into the nasal septum and slightly rotate it to the posterior aspect to the back. Okay, then after that it will be secure only here. So if it is using also, some complications may arise. So that complications will be any trauma will come, any bleedings will come, or any airway obstructions also will come.
Good afternoon everyone. Today I am going to deal with the topic of oropharyngeal airway. Oropharyngeal airway is also known as godial airway, rigid curved tube designed to keep the upper airway open. It is used for the unconscious patients and unresponsive patients to prevent the tongue from the covering the epiglottis. So what are the indications to keep oropharyngeal airway? It is used for the unconscious patients and unresponsive patients and upper airway obstruction. The patient is suffering with upper airway obstruction and backfall of the tongue, and to facilitate the ventilation, to prevent the aspiration. So these are the indications for the oropharyngeal airway. So what are the contraindications? Which patient we should not supposed to keep the oropharyngeal airway? For conscious patient and semi-conscious patient, we should not keep the oropharyngeal airway. For the patient is suffering with oral and facial trauma, we should not keep this oropharyngeal airway. And presence of gag reflexes and recent history of the recent oral surgeries. So these are the patient we should not keep the oropharyngeal airway. So how we will measure the oropharyngeal airway? We will measure with corner of the OPA with angle of the jaw. So this is the way we are supposed to measure the OPA. So in this three sizes are there. 2, 3 and 4. According to the patient size, we will select the size and we will keep the oropharyngeal airway. Steps of insertion. How we will insert the oropharyngeal airway? Hold the tip of the OPA towards facing the roof of the mouth. So gently insert into the mouth. Slightly rotate 180 degrees motion so that it will reaches into the concave shape will reaches into the posterior oropharynx. So this is how we will insert the oropharyngeal airway. So last, while keeping the oropharyngeal airway, there is some complications. What are the complications with oropharyngeal airway? There may be possible of oral trauma and gag reflexes, ineffective ventilation due to inappropriate OPS size. So this is the information regarding the oropharyngeal airway. Thank you.